What's new from Apple? There's the new iPhone 16 Pro, built for Apple Intelligence. And it comes with the all-new camera control, giving you an easier way to quickly access your camera tools. The new Apple Watch Series 10 has our biggest display and our thinnest design ever. And this? It's the sound of active noise cancellation, now available on one of 2 new AirPods 4 models. So quiet. Check out all of the new products and new features at apple.com. You can even buy yourself something new. See apple.com for product availability updates. Apple Intelligence coming this fall.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
Earning your degree online doesn't mean you have to go about it alone. At Capella University, we're here to support you when you're ready. From enrollment counselors who get to know you and your goals, to academic coaches who can help you form a plan to stay on track. We care about your success and are dedicated to helping you pursue your goals. Going back to school is a big step, but having support at every step of your academic journey can make a big difference. Imagine your future differently at capella.edu.
Did you hear about the contest to win a ton of cow manure? To the victor, go the soils.
If you just read the bio for Dr. Steve, host of Weird Medicine on Sirius XM 103 and made popular by 2 really comedy shows, Opie and Anthony and Ron and Fez, you would have thought that this guy was a bit of, a clown.
Why can't you give me the respect that I'm entitled to?
I've got diphtheria crushing my esophagus. I've got Ebola virus dripping from my nose. I've got the leprosy of the heartbound, exacerbating my incredible woes. I want to take my brain out and blast it with the wave, an ultrasonic echographic and a pulsating shave. I want a magic pill for all my ailments, the health equivalent of Citizen Kane. And if I don't get it now in the tablet, I think I'm doomed and I'll have to go insane. I want a requiem for my disease. So I'm paging Dr. Steve. Dr. Steve.
From the world-famous Cardiff Electric Network studios, it's Weird Medicine, the first and still only uncensored medical show in the history of broadcast radio. Now a podcast. Someone listening to this for the first time would think, who is that nut? I'm Dr. Steve with my little pal, Dr. Scott, the traditional Chinese medical provider who gives me street cred. The wacko alternative medicine assholes. Hello, Dr. Scott.
Hey, Dr. Steve.
This is a show for people who've never listened to a medical show on the radio or the internet. If you've got a question you're embarrassed to take to your regular medical provider, or if you can't find an answer anywhere else, give us a call at 347-766. I almost gave out my cell phone number. 347-766-4323. That's 347-POOHEAD. Follow us on Twitter at Weird Medicine or at DrScottWM. Visit our website at drsteve.com for podcast, medical news, and stuff you can buy. Most importantly, we are not your medical providers. Take anything you hear with a grain of salt. Don't act on anything you hear on the show without talking it over with your doctor, nurse practitioner, practical nurse, physician assistant, pharmacist, respiratory therapist, chiropractor, acupuncturist, yoga master, physical therapist, clinical laboratory scientist, registered dietitian, newly minted nurse practitioner, a.k.a. Kim Chickens or whatever. Very good. All right. We're still live with stuff.drsteve.com.
For now.
I don't know how for much longer because I sent them a response, and then they sent me another one that says, thanks for your response, but we need this, and this. And I still don't understand what in the hell they're asking me. So I took a bunch of screenshots and put it on a Google Drive and then gave them the link, and hopefully that's enough. If not, we'll figure something else out. But go check out stuff.drsteve.com for all of your Amazon needs. It does help to keep us on the air, and we really do appreciate it. And I appreciate Amazon. We've been an affiliate of theirs for a decade, a decade and a half now.
Yeah.
I don't know what I'm doing wrong. I haven't changed anything. So I just... they're kind of hurting my feelings a little bit, but I want people to keep using it because it's Amazon.
Yeah.
Who doesn't want to be affiliated with them? right?
in the right mind. Yeah, I love it.
Hell, I buy everything there. So.
Yeah, me too.
All right. Check out Dr. Scott's website at simplyherbals.net. That's simplyherbals.net. How's the CBD laced nasal spray going?
Like wildfire.
For real?
Yeah.
Yeah, good.
People in it, and I love it too. So people seem to enjoy it. I need to bring you some.
I know. I gave yours away.
Yeah.
Or gave the one away. Who'd I give that to? Mel B?
Nope.
Who'd I give it to?
P.A. Lydia.
P.A. Lydia?
Yeah,
okay, well, she deserved it. So, if you could bring me some, that would be great. I would love to try it.
We'll do.
And
it's good for you.
Check us out. Our Patreon. Listen, I know I've plugged it before. You want to do the Patreon. We had Robert Kelly on. I'm not sure if that one is hit yet. And what we're doing is this sort of reverse thing where I don't interview them. They ask me medical questions. It's so stupid. I call it the exam room. But there's a mystery guest that was supposed to be on last week, and he bailed on us. And he was revealed during the Robert Kelly one, and then he'll be on the one after that. Mm-hmm. So those come out every 10 days. And then I throw up some old classic content and stuff you cannot get anywhere else, including some pictures that I'm not going to put on the regular internet. Mm-hmm. And then, I may take some pictures of the original script and some other things like that. We've got some memorabilia around here that's kind of cool, old school stuff. And then old shows that you can't get, including SiriusXM. I got to be careful. I can't just throw up whole SiriusXM shows, but I can throw up some excerpts. As long as I attribute it. So anyway, go to patreon.com/weirdmedicine. It's relatively inexpensive, and that's going to help a lot, particularly now that Tacey has gotten retired against her will from her job. Whoops. And then check out my favorite new thing, chef.drsteve.com. You got to spell the whole thing out, or just go to the website. It's on there. The link is there. It's you can get $130 off your first order with absolutely the best meal prep kit on earth that I've found so far. Unless Blue Apron becomes a sponsor again, then I don't know. But I'm just kidding. It's Green Chef. Green Chef is awesome. Everything's organic, but it's not organic. It's just organic because it's good.
Right.
And everything is the quality of the vegetables that come. I've had problems with some of these before where the green beans were kind of looked old or freezer burned or something.
Yeah. Yep.
Stuff looks like it came right out of the garden, except it's washed. And it's great. So anyway, check out chef.drsteve.com. $130 off your first order. If you're keto, you can get that. If you're gluten-free, you can get that. You can basically get whatever you want. And Dr. Scott, they have pescatarian options for you maniacs
pescatarianites
that eat fish and get high mercury levels. Have you ever gotten your mercury levels checked with all that fish that you eat?
No. Okay. Probably should. I'm sure there's a lot of shit I need checked.
Yeah, me too. Speaking of that, I need to get my ass checked. I haven't had I think my doctor last time forgot. Oh,
here we go.
Oh, here we go. Perfect timing. Tacey, you're on Weird Medicine. Hello.
Hey,
you're on.
don't go, John.
You're on the air.
Oh.
Don't hang up. Oh, God damn it. Okay, we'll be right back. Jeez.
Good stuff.
I told you the story about how I lost a chance with the hottest woman that worked at WXYC at University of North Carolina, Chapel Hill, didn't I?
Yep. Tell it again. That's a good story.
Is it a good story?
It's
not. It's good for you, and not good for me. But I was talking like that.
Painful, yep.
I was, and you could. Your mic is
painful.
I was talking like that, except worse. I was talking up a record, and we were an FM station. I'm like, and it's WXYC Chapel Hill, like that, and she just was sitting behind me, and for no reason, she wasn't there for any reason,
right?
And she was so ridiculously hot. And it turns out later that I found out that she liked me. That's why she was standing in there or sitting in there listening to me. And she just went, why do you hype your voice like that? And what she was really trying to do is be helpful. She said, you have such a beautiful voice.
Yeah.
She's trying to be complimentary. But all I heard, I'm like Rich Voss. Voss will do a show, and there'll be 100 reviews. They're all positive except for one, and that's the one he focuses on.
Oh, yeah.
Tacy's same way. She's not here to defend herself, but she knows I'm right.
Mm-hmm.
And, her boss will say, you're great on this, and this, and this. There's just, we could tweak this or that. And that's all she hears is, oh, wait, I'm not perfect?
Yep.
We have to tweak things? What the hell does he mean, tweak things? Well, anyway, we'll talk about that on the Patreon show when she's here. But anyway, so that was me. And I just heard that, and I went, well, that's what I've been trained to do. And I just got real indignant, and then I just sort of ignored her, and she walked out, and that was the end of that.
Oh man!
And then somebody was like, she likes you, and and I was like, what?
Oh.
Yeah. So, but it was too late. I had already, if you show your ass that early on,
played the cards early.
You're effed. And I remember in high school. There's no high school kids listening to this. But I was in high school, and there was this girl in my class, Jane Mulhook was her name.
Okay.
And she was fraternal twins. Her brother, I can't remember his name, but I remember her. And she was, fiery redhead, gorgeous.
Okay.
And my friends all knew that she was writing my name on her books, like you do when you're in 7th and 8th grade.
Sure. And
you write somebody's name on your books and stuff. They all knew it.
Mm-hmm.
Not one of those assholes told me. Because I would have been of course, I would have acted crazy because I had no game. I learned how to do magic just so I could meet women in like bars and stuff.
That's awesome. And
I had to have something because I had zero game. I would have just been,
falling all over your radio voice.
Yeah.
I am so smart. I am so smart.
I didn't have the radio voice back then. I was just coming in, so I was
come through puberty.
Hello, Mr. Douglas.
I love it. I love it.
So
that's cool.
Only a few people are old enough to get that reference, but
yeah, I don't even get that one.
You don't?
Mm-hmm.
It's from Green Acres.
Oh,
it's Mr. Haney.
Okay, got you, Mr. Haney. Right.
Well, and now hello, Mr. Douglas.
Yep. I got it now. Yeah. That is funny.
All right.
That's funny. Good stuff.
Well, So anyway, Jane Mulhook, if you're out there, I'm sorry, I'm an idiot.
Yeah.
But my friends could have had my back on that one, but they were so repressed, they didn't know what to do either.
Yeah. No, especially at that age, it is a pretty tough thing, isn't it?
Yeah, and there was another one.
Navigating those waters.
In 9th grade that I found out liked me after.
Yeah.
And I acted like an asshole in front of her, too.
Oh. Yeah, you should have. You needed a coach. You needed
just be coach. Nice to. Just be gracious. That's the thing. But my friend had a party, and they had water balloons, and so this girl at the time, I guess we were in the 9th grade.
Mm-hmm.
And it sounds weird to call her a woman because we were all underage. But anyway, this girl, who I also liked. Mm-hmm. I thought she was awesome. She chased me around with this water balloon, chased me to almost into another neighborhood. And we were alone together. And then I just kind of stopped running. And then she went, oh, and like that. And then we just walked back. And I think I walked 10 feet in front of her the whole way back. What a fucking idiot. What an idiot.
Oh, my God.
Well, that's because you're an idiot.
Well, there you go.
So what are you going to do?
That's hilarious. Good times.
But I was just shy and repressed, and I was self-conscious. That was the thing. I just heard my voice when I talked, I just hated it.
Yeah.
And I just cringed whenever I opened my mouth. And that's one of the reasons why I learned magic. because then at least I could break the ice. Once I could break the ice and get the conversation going, it was fine.
Oh, yeah, sure. Well, and I think that's why it was so nice for you to pick up your magic tricks, because then that breaks ice pretty well.
That's what I'm saying.
Yeah, I know. I love it.
Yeah, okay.
How old were you when you started doing the magic?
I did my first live show in the 7th grade for the 7th grade talent show.
Oh, my God.
Now, that's not the kind of magic that gets you any girls.
No.
What does is close-up magic.
Mm-hmm.
And you can't – the worst thing – okay, Somerset Maugham wrote in one of his books, and I'm just quoting, he asked me if I liked card tricks. I said no. He did 5. And what he was doing was very quickly sketching out how obnoxious this person was. So you can't do, those shitty ones where look at where the queens are, do. You need to learn magic that looks like real magic. And there are things like that.
Yeah.
There are effects out there that you can learn to do that look like real magic. I have one called Card Warp that's very easy to learn, and it looks like sorcery when you do it. And anybody can learn it. And you can just get on a magic catalog and buy one.
That sounds fun.
There's another one that I can't tell the secret of.
Uh-oh.
But it's one where you read the person's mind and they read yours.
Okay.
And it actually works.
Huh.
Like they read your mind and say, I predict that you have picked the 6 of clubs, and then you turn it over and that's what it is. Okay? It's and that sort of making that connection, and then they're like, how the hell did you do that? And then there's that opens up conversation. So if somebody is got no game like I did and you want to learn that trick, email me. We did this once before about 10 years ago when people emailed me, and I'll hook you up with where you can buy it. I can't reveal the secret, but I can teach the secret to somebody.
Yeah. Did you start the video feed?
Yeah, I just
the sound. Yeah, the sound is good. It's the
Okay, there we go. Thank you. Thank you for reminding me, whoever that was. Okay.
Yeah. Sean, thank you, Sean.
Sean's a good, I'll tell you. All right. You've got some stories, and I've got a couple.
Yeah, we got a couple. We've got some good news. We talked a couple weeks ago about the guy who had the pig heart.
Yep.
Transplant.
Yes.
Well, the great news is Mr. Bennett, 57-year-old Pittsburgh Steelers fan. Well, which is
fine.
School?
I don't know.
He's doing really, really well. He's doing extremely well.
Still alive.
Still alive and doing well. I think they said he's 5 weeks out.
With no anti-rejection drugs? Are you sure about that?
No, I didn't know. I'm not sure about that, but I'm saying that they say the heart is doing well. The cardiologist trying to find any fault, but so far they've not been able to find any fault.
Yeah.
And the heart is contracting vigorously as it should be. And
they bred these pigs not to have certain immune identifying proteins and glycoproteins on their surface so that the body wouldn't reject them as readily. I just didn't know if they had to take anti-rejection drugs anyway, or if they're completely washed of antigens. That would be cool. But I bet they still have to take something.
One would think.
There's nothing in there about that?
No, I've read it twice, but I don't see anything saying specifically if they do or do not. But yeah, they were talking about just having the gene editing for the pig's heart to make it more viable.
Okay, so if you Google pig heart transplant anti-rejection drug, here's the answer. It says surgeons announced that they performed the first transplant of a pig heart to a human. I can't believe that was the first time that had ever been done. I guess maybe first successful one.
Oh, the first one reported, yes, exactly.
Right. Okay, they did 10 genetic changes in the pigs, a novel immunosuppressant given to the recipient. So they are on an anti-rejection drug, but it's a new one. Okay. Oh, and a cocaine-laced solution used to incubate the heart. Excellent.
Oh, cool.
I like that.
That's good stuff.
I like any clinical use of cocaine. I've told you that story on this show of us doing cocaine and accidentally. Well, it wasn't accidentally. We were doing a procedure on each other. We were learning how to do flexible endoscopy on the nose. and flexible. It was flexible laryngoscopy, so you stick it through the nose, and we'd have to use these cotton pledgets, which are just strips of cotton laced in this blue solution,
which is cocaine.
And we would. That's right. Well, right. It was methyl algoconide or methyl algoconine, and we didn't know that meant cocaine. And so we were just saturating these cotton pledgets and shoving them in each other's noses, and then that would open up the airways, and then you could stick this thing in there and also numb it up at the same time.
Wow.
And what we didn't realize, you were only supposed to do it once, but the process was saturate the cotton pledget, put it in, and then do the thing. So every time that I would do my friend Ty, and I'd put the cotton pledgets in and do it, and then he'd do it on me. And it's like, okay, let's do it again. I'd put the cotton pledgets in again with new solution. Okay. By the time we were done, we were high as a kite.
Oh, bad.
Didn't have any idea why rounds was so much fun.
Oh, wow.
That afternoon. We just had a blast on rounds. And then once I realized what had happened, I understood why people love that drug.
Oh, gosh, yeah. It's
As a matter of fact, there was a guy in our lab that was conspiring to break in to the lab to steal the blue solution. And we were like, dude, if you do that, that's the end of your career.
Yeah, that's it forever.
And he was still considering it. He decided not to do it.
Oh, good.
But it was after one dose, this person was almost ready to throw their career away, or at least put it in jeopardy just so they could get more of it. So that's, cocaine's a hell of a drug.
It's a hell of a drug. It's a hell of a drug.
It sure is. So,
golly.
All right.
Unbelievable.
All right. What else you got?
Well, in kind of along that same line, we won't get into the weeds on this, but there's, speaking of the transplant thing, I saw an ex vivo enzymatic treatment that converts blood type A donors into universal blood donors.
I saw that.
Yeah.
You want to talk about that?
Which is pretty incredible, because that's kind of going on what you're talking about with the pig heart. Is these scientists, researchers were actually adjusting some of the enzymes, and only two enzymes in this case for the lungs, but we're able to make the blood type universal so that you can have, because one of the problems with
they're
the
just
lung,
basically stripping out the O antigen somehow.
Yeah, and
without messing the blood up.
Without messing the blood up, right? So that it makes people potentially able to get a much more broad selection
that
of
would
lungs.
be for emergency use.
Right,
Listen,
right,
the thing is if you were type A, we want to give you type A blood. We don't want to give you type O blood. But in an emergency, you could if you had to. So how do they say they're doing that? They just take it. So someone with type A blood is donating it.
Yep.
They put it through this process, and it comes out the other end being type O.
Somehow they convert. Yeah,
somehow.
Here we
go.
Listen. I just opened up not too long ago my show prep.
Is this one?
I didn't want to work overtime this week.
No, that's fine. Is this one of the ones that I sent to you?
It is. Yes.
It is. Okay.
Yeah.
Okay. In Nature Microbiology, new paper presents a viable way to convert type A blood into O using, as you said, enzymes.
Mm-hmm. Two enzymes, which is kind of
from
cool.
the gut bacterium. Oh boy, Flanovifractor plautii.
Ooh, that may be a new band name.
Ladies and gentlemen, Flanovifractor. That's not a bad one.
I like it.
It's a little hard to say.
It's kind of difficult.
No harder to say than Corunbin, though. So, when these enzymes are added to type A blood, the molecules on its surface that define it as type A become unattached, turning it into type O. Now, what do? They have to wash out those molecules, though. But that's very clever.
That's super
good for
great.
them.
That's super cool.
Good for them. Oh, I love stuff like this.
Yeah, it just goes to show you that we're just getting closer and closer to finding some new treatments for maybe some things that have been really problematic.
Yeah, we need to get to Star Trek at some point.
There you go.
Where we've conquered poverty, conquered racism, conquered viruses, except for the virus from Borrelia 3 or whatever causes some damn disease. That's the thing that cracks me up, is they've conquered everything, but there's still, it's like Imzadi still has some terminal illness on Picard that's caused by somebody. You all can't figure that out? Just teleport it out of them.
Teleport it out.
That's
it's not
Larry
that
Niven
rocket
wrote a
science.
thing where they had this thing called dicta immortality, and what it was they would put their hands on these two sort of electrode-looking things, and it would teleport out all of the toxins and stuff out of your body.
Mm-hmm.
And then people, like me with gray hair, their hair would start to turn brown again and all this stuff, and they would live way longer than the normal lifespan.
That's cool.
And there's no reason why, if we're going to do teleportation, that's kind of stuff you want to do. You want to be able to do like Scotty did to Chekhov when he fell off of that bridge in the journey home, where he's like, oh no, he's got an intracerebral bleed, and they were going to take him to the hospital. He's like, these bloody barbarians, and he just took that little device and passed it over Chekhov's head and repaired the arterial bleed in his brain. We need to be able to do that kind of stuff.
That would be kind of fun.
Anyway, all right. That's idiotic, but still
crazy.
Truly, though, the medicine that we practice now would seem like magic to someone from the 1700s. So Arthur Clarke, I'm throwing out the quotes today. Arthur Clarke said that any sufficiently advanced technology would appear as magic to us.
Mm-hmm.
So that's why Thor from the Thor movies, they're not really gods. They just come from a dimension where their science is so advanced it seems like magic to us.
Oh, that's wonderful.
Yeah. Go F yourself. Peacemaker was
awesome. Oh, I'm
greatest
sure.
show ever made.
I'm sure
was Peacemaker.
I'm sure it was captivating.
It was so great. It was so great. Okay, I've got one for you, and then we'll get to phone calls.
Cool.
So this is from Al. It says, good afternoon, Dr. Steve. This is Al. I unofficially feel challenged about the ICD-10 codes. I don't know why. I think his were the best anyway. He wins. Says, I have to win this non-war of attrition, although DNP Carissa had some good ones. Here is two more I think should help me win my own game.
Okay,
He won't be winning the grammar game, but I think he's going to win on this one. These are great, so you can get excused for that. And that's just my journalism degree kicking in. V90. Oh, so for people who aren't aware of what I'm talking about, these are codes that we can use to label diagnoses when we're billing insurance companies. So like the old ICD-9 code for diabetes was like 250, and then you could add on point other things to mean out of control or poorly controlled or well controlled, that kind of stuff. So now we have these ICD-10 codes. These are new, and most of us don't have them memorized like we did the old ones yet. But here's a good one. V91.07 XA. I don't know why it has that suffix on it. This is so idiotic. Burn due to water skis on fire, initial encounter. Now, how many times did that have to happen that you have to create a damn code? I swear I think the people at the ICD-10 place just get bored and they start creating codes for no reason.
Burn due to water skis.
On fire.
On fire.
Initial encounter, which implies that there's a subsequent encounter and a sequela encounter, because they usually have three.
I'm just kind of trying to figure out how these.
Well, obviously there was a gas leak.
Yeah.
And it caught
from the boat. And
from the boat. And then somebody flicked a cigarette out there, and it caught the wake on fire. And this person is skiing. And now, instead of just letting go of the handle.
Because you see the fire coming towards you.
Yeah.
Yeah, dropping off.
Yeah. I guess they were afraid that if they did, they would be surrounded by fire, which I guess is a concern.
Jeez.
So especially if they didn't know what was going on. So now the fire is in front of them and behind them. So now you don't want to get out. But what you can do if you're on water skis is get out of the wake.
Yeah. Yeah.
Go to the side.
You swing out. You swing out to the side.
Swing out to the side and then let go. Good Lord. But this poor person got these burns, and then they created this code. We have to learn. Remember a couple of weeks ago, we had the code caught in a jet engine subsequent encounter.
Right.
We wondered how there would ever be a subsequent encounter. And then Chest Pain Rob told us about that case of that person that got sucked into a jet engine and they survived.
Oh, jeez.
How is it that they just make these codes? Because I see stuff all the time that there's no codes for. I can't just make them up.
Yep. Now, I wonder if you have one if you submit it
I guess.
for reimbursement or something.
Oh,
yeah, maybe.
Really?
I don't know. I wonder.
Can you look that up?
Yeah, I guess,
how to
yeah.
submit an ICD-10 code, and let's submit a few.
Sure.
Because we'll do ears bleeding from listening to Myrtle Manus on the Dr. Steve show. Well, that'd be a good one if you could do it. All right. Here's a good one. It says, in the medical industry recognizes family is a hazardous situation. Z63.1, problems in relationship with in-laws.
Oh.
Well.
Weird Medicine contains mature contents that may be offended to some listeners.
Let me
What did I do wrong then? Your all's house is like an oven.
Yeah, that's my mother-in-law, Big Joe. Thank you, everyone. All right.
I love it.
Never any problems with her.
No.
Nothing.
Nothing at all.
Oh,
that's funny.
She got COVID, and she was house sitting for us, and my wife said, never again. Never again. I don't begrudge her having COVID.
Right.
She sits with people in the hospital. That's her job.
Mm-hmm.
So you knew she was going to get it because she's not properly washing her hands and coming in and out of the room, and they're probably just coughing on her anyway. So there wasn't any way that she could maybe even have prevented it, even if she did have good hygiene. But
sure.
I just remember her calling me and just coughing and coughing. I could hear it echoing. I could tell what room she was in. She was in the kitchen. I could just tell from the echo. Just coughing all over
everything,
every surface in the place.
Oh.
And then calling me up 2 days later. Now, Steve, I'm having chest pain. It's like, well, Joanne, if you're having chest pain, you need to go to the emergency room, COVID or not. Well, Steve, I always have chest pain. You know that. And she's getting mad at me. It's like, well, then why'd you bring it up? Maniac.
She's a nut.
Coughing everywhere.
Yeah, she's a nut.
When she left, this was before vaccines, before any legit treatments. We were kind of freaking out, and so I had somebody come into my house with a hazmat suit and clean every surface before I said, go home. You are no longer house sitting.
That is hilarious.
And they had them clean every surface, and then Lady Diagnosis was kind enough to finish out her tenure. And
Big Joe.
Big Joe.
She's a hoot now.
Well, I always have chest pain. You know that.
I love it.
Ugh.
I love it.
All right. Here's another one. W58.21XA. Struck by a turtle. There you go. Not bit by a turtle. That one I could see. I had a friend of mine try to pick up. We were in Baton Rouge, Louisiana. There was a big old, what we thought was a box turtle in the middle of the road, and he went to pick it up, and the thing kind of hiked up on all 4 feet, and we were like, why is that box turtle acting like that? And pew, when things spun around, it was a snapping turtle.
As I say, yeah, that's no box
They can
turtle.
move really effing fast when they want to, and he just about lost a finger on that one.
I'll bet.
So,
I was just thinking, if you're struck by a turtle, does that mean somebody's picked one up and hit you with it?
Or
whacked you in the head with it?
Or they somehow hit it, it flew up.
If you're on a boat going really fast.
That could be one. Yeah, and it flew up and hit you. Or they hit it with a car and somehow, instead of squishing it, they did like the TV.
Well, it's because you got
hit the windshield and then.
It's because you got your brother and your cousins in the back of your truck, and you hit the thing with your truck and it flips up, and
that's it.
That's what it is. When they're running down the country road, that's got to be what
Or they're
it is.
throwing turtles. They're throwing them at stop signs as they go real fast, like my friend did, and almost died. He wasn't throwing turtles; he was throwing
beer cans. Or
beer
something?
cans.
Yeah.
And listen, if you're going to do that,
damn
don't
hillbillies.
Yes.
Don't throw glass.
This guy was from the football team, and we were long hair hippies, and I think we ended up in the same detention or something. we had done something, and he thought we were cool, and we were like, "Damn, this guy, the running back thinks we're cool." So we went out with him, and what he wanted to do was for one of the guys to drive his pickup truck as fast as he could through backwoods roads in Louisiana while he threw full beer cans at mailboxes and stop signs. So that's what he wanted to do. So he's standing in the back, whipping, which, number one, why it's a waste of good beer. Mm-hmm. But number two, it's dumb as shit because he threw one at a stop sign and it ricocheted and hit him right in the chest. Oh. We thought he was dead.
No, that's terrible.
Yeah, he was like, oh. So we stopped doing that and drank the beers, and that we had more fun. But we didn't hang out with him anymore.
Much more sense.
He realized we weren't any fun.
Hey, I think Sean may be onto something.
Okay,
what happens if you're on flaming water skis and you hit a turtle?
Yeah,
that'd be a terrible.
You can use more than one coat.
You can use more than one coat. That's right.
So
followed by whatever the code is for really bad
and then your
luck.
in-laws are yelling at you, "You dumbass!" So then you could use that one as well. So you could use all three.
Didn't you see that turtle?
Yeah. Are you blind?
Oh, you...
Oh, God.
Oh, my word.
All right.
How about some questions?
All right, sounds good.
Today's episode is brought to you by Angie. Angie has made it easier than ever to connect with skilled professionals to get all your jobs and projects done well. Let me tell you, there's the version of it where you try to do something at home, and then there's a version of it where you have someone help you, you watch them do it the right way, and you go, thank God I didn't try to do that myself. I have fully done things around the home that I think look good, and then a bang in the night, and I wake up to a shelf collapsing, a painting falling off the wall. I've seen it all go south. I own a home, and I can tell you, I know how much work it can take. Whether it's everyday maintenance and repairs or making dream projects a reality, it can be hard just to know where to start. But now all you need to do is Angie that and find a skilled local pro who will deliver the quality and expertise you need. Whatever your home project, big or small, indoor or outdoor, you can Angie that and connect with skilled professionals to get the project done well. Right now, one of my wish lists is I want a bike for my condo in Milwaukee, and I would love to rig it up on a pulley in the ceiling because I have one of those lofted ceilings, but I'm so scared to try that on my own. Angie has 20 years of home experience, and they've combined it with new tools to simplify the whole process. Bring them your project online or with the Angie app. Answer a few questions and Angie can handle the rest from start to finish, or help you compare quotes from multiple pros and connect instantly, which means you can take care of any home project in just a few taps. Because when it comes to getting the most out of your home, you can do this when you Angie that. Download the free Angie mobile app today or visit Angie.com. That's ANGI.com.
With Walmart's new fresh and frozen subscriptions, you can save time on your weekly grocery shopping.
Dad, you're supposed to be grocery shopping.
And miss the chance to embarrass you in front of your friends? I subscribe to snacks and wet napkins. You know how messy you are.
Dad!
Walmart. Subscribe to your weekly list.
This episode is brought to you by PNC Bank, who believes some things in life should be boring, like banking, because boring is steady, pragmatic, responsible. You don't want your bank to be cool or sexy. Sexy is for red carpets, not banks. That's why PNC Bank strives to be boring with your money, so you can be happily fulfilled with your life. PNC Bank, brilliantly boring since 1865. Brilliantly boring since 1865 is a service mark of the PNC Financial Services Group, Inc., PNC Bank, National Association, member FDIC.
Hi, I'm Lara. After 20 years of making Lara Bar, I still believe that simple and real can be indulgent and delicious. From chocolate chip cookie dough to cherry pie, there's a Lara Bar made for you. 100% real, 100% delicious. Find your flavor at larabar.com.
This episode is brought to you by AutoTrader. Look around. What do you see? Cars. Lots of them. And guess what? They're probably on AutoTrader. Whether you're into timeless classics or the latest trends, if you see it on the road, you can likely find it on AutoTrader. New, used, electric, and one day, maybe even flying cars. See a car? Find it on AutoTrader. Visit autotrader.com to learn more.
Let's do it.
Don't take advice from some asshole on the radio.
All right, thank you, Ronnie B. I could not disagree more. Could not agree more. I agree. Always agree with Ronnie B. All right, let's see here.
Calling for my wife.
Okay.
She's on an insulin pump.
She's on an insulin pump.
And she's also doing keto.
Okay.
And sometimes at night, she has lows, like serious lows, where the meter reads it doesn't even give her a number; it just reads below.
Okay.
So anyway, below 46 apparently she just said. But anyway, she wants to know what are some things that she can take or have or eat or drink that will allow her sugar to go up, but not cause her to get out of ketosis.
Yeah, I got it.
She's been drinking like 20 to 25 carbs worth of Coca-Cola, and she's afraid that it's keeping her in.
Yeah, out of ketosis.
Kicking her out of ketosis or keeping her very minimal ketosis.
Yeah.
Any feedback that you have? Also, she has another question. She wants to know. She keeps her Dexcom that reads her blood sugar in her gut, and she wants to know. Sometimes there's a big difference between the gut reading and the reading she does on the finger. She wants to know if the gut reading is because it's closer to where your body is making that insulin, so you're going to have a lower blood sugar in your gut
that's
than
an excellent
your
question.
extremity because it's further away and the blood has to pump that far. Like her pump will say 47, and when the blood stick will say like 120 or 130.
Oh, God, that's
a
huge difference.
Thank you. Bye.
Okay, yeah, thank you. So then he called back before we answered these questions.
Hi, Dr. Steve. My wife is upset that I used the word her gut, and she'd rather I use the word her fat stomach.
Oh, God, dude.
There you go.
Dude, well, then now she calls. Let me see.
Oh, no.
Hi, Dr. Steve. I'm sorry. My husband's a douche.
So, it's a nice trilogy. He's laughing. That sounds like they have a good old time.
That's cool. Her fat. I love it.
And she was laughing.
Oh,
and then,
my God.
Anyway,
That's hilarious.
So these are some excellent questions. The second question about the disparities between the gut reading and the finger stick. I think the finger stick's always going to be more accurate. And I would look at the placement, and I would also talk to whoever is selling her that device, because something ain't right. It really should be about the same everywhere, unless you are using old capillary blood at the surface of the skin compared to good venous blood in the finger, and in which case that blood that's reading low, the cells have already started to use up the sugar in there. So it's less central, and I don't know how big she is. He was being an asshole, so I don't know. But if it's less central than taking it from the finger stick. So that would be my guess. That's just a guess. We'll do some research on that.
I love it.
Now the other one is a whole nother ball of wax. So let's talk a little bit about ketogenic diets in insulin-dependent diabetics. Now she is having hypoglycemia. And if it's symptomatic hypoglycemia, she's going to have to take something. In other words, symptomatic, if she's having symptoms from her low blood sugar, she's got to take something that will get her blood sugar back, and that's going to almost always be something with glucose in it.
Right.
So that it's going to be hard to get out of, but you're going to still be in ketosis very quickly, because it's just the insulin's going to be it'll balance out, then you'll be back where you were before.
Right.
Now, my question is, we need to prevent these hypoglycemic episodes. And first, we need to confirm that they really are hypoglycemic episodes, because she's got an abdomen reading. I'm going to say abdomen, because she was offended by gut, and I'm not using the second thing he said. No. So her abdomen reading is much lower than her finger stick reading. And if she's not symptomatic, the finger stick reading is probably the correct one. So we need to confirm that she's actually having hypoglycemia episodes. And there are a couple of things that they can do, but it's without getting too deep in the weeds.
Can I tell them real quick some hypoglycemic signs and symptoms, though?
Absolutely. Please do.
Well, just like if you'll see people get pale.
Yes.
Sometimes they'll get a little confused.
Yes.
Sometimes they'll break out in little sweats.
Yes. We call that diaphoresis.
Excellent. And so all of those are signs and symptoms of or some of the signs and symptoms of hypoglycemia.
Exactly right. So, but if it's asymptomatic, if she's not having symptoms with it, and her finger stick says 127, I'm going to say bullshit on the abdominal reading for now.
Right on.
And that one is the one that's suspect. But if there is true hypoglycemia, prevention is the way to go. If she's doing a low-carb diet, she may not need as much insulin as she had before. The reason that you need insulin, and I'm going to assume she's type 2 diabetic.
Okay.
So she's the type of diabetic that has poor insulin sensitivity. She produces tons of insulin, but the body doesn't understand it. So you're using the insulin pump to kind of overwhelm it.
Right.
Even if she's a type 1, but let's just say that she's type 2. If she is on a ketogenic diet, she may have regained some insulin sensitivity because that is one of the benefits of that diet in people who are diabetic, particularly type 2. Mm-hmm. And if she has, she may not need as much insulin. She's got to talk to her endocrinologist about this. Mm-hmm. I'm having all these hypoglycemic episodes because what they're going to do is turn the pump down.
Right.
But we need to know that that's right. And one way to like I said, there's some tests that they can do. They could just do a hemoglobin A1C and see what her hemoglobin A1C is, but that will just give you an average over 3 months. It won't tell you if you had a low blood sugar last night. Mm-hmm. So they may give her some ambulatory monitoring stuff. There's some other things that they can do. Mm-hmm. They could do a challenge test, give her 50 to 200 grams of glucose and then just see what happens. If her blood sugar drops, then they know that's what it is.
Right.
There's a lot of stuff like that they can do. And I don't want someone on an insulin pump doing a ketogenic diet anyway, unless they've talked it over with their endocrinologist. I'll tell you why. If you come into the hospital and you're on a ketogenic diet and your blood sugar's elevated and they check your urine and they see ketones in there, they're going to admit you immediately thinking that you have diabetic ketoacidosis, even though you're probably not acidotic. Mm-hmm. Okay, so diabetic, so they're diabetic. Keto, they've got ketone bodies in their urine. It's a product of fat metabolism. Mm-hmm. And when you have fat metabolism, usually in a skinny type 1 diabetic, it's because they can't metabolize sugar anymore because they have no insulin. Mm-hmm. Okay, but ketoacidosis, you're going to be acidotic. In other words, your blood pH is going to be markedly less than 7.4.
Right.
Now, a lot of doctors are not good at this. Mm-hmm. Okay, they've forgotten the fundamentals. So I had a doctor call me once in the emergency room. I have a kid over here, and she's 7 years old, and she's in early diabetic ketoacidosis. I was like, wow, what, early DKA? Usually when kids are, convert to type 1 diabetes, they don't come in early DKA. They come in full-blown DKA. They're sicker than hell.
Yeah.
And they need emergency treatment right then. Mm-hmm. You get an insulin drip going, you do this and that. There's a lot of blood work you got to do. You got to monitor them every hour, et cetera. So he said, this kid's in early DKA. And I said, well, that's interesting. What, I'm not sure what that is. What's the kid's blood? He said, she's been vomiting all day, and she's got ketones in her urine. I said, what's her blood sugar? Mm-hmm. And he said, 89. I said, are you out of your fucking mind? In my head, I said that. I didn't say that to him. How can you have diabetic ketoacidosis with a low blood sugar?
Yeah, that makes sense.
No, doesn't make sense. It's idiotic.
Yeah.
And then he said, and her pH is 7.5. I'm like, where's the acidosis?
Yeah, that's not acid.
That's alkalotic.
Right.
So what was happening was she's a 7-year-old kid, very little body fat.
Sure.
Couldn't eat for the last 18 hours because they had a viral gastroenteritis. Mm-hmm. She was having diarrhea and throwing up. So she was alkalotic, maybe hyperventilating a little bit, but alkalotic because she had been pooping out, acidotic, watery stool.
Yeah. And she's dehydrated.
And she's dehydrated, and she's not eating, so she's producing ketone bodies because she's metabolizing fat to keep energy going.
Yep. And probably at that age, she didn't have a whole lot of reserves
No.
anyway. Yeah.
So,
Thank goodness he called you.
That's
or that person.
Yeah, he's like, you have to admit her. And it's like, I'm not admitting. He's like, well, I will report you. I said, okay, you know what? I'll just come in. I'll take care of it.
Yeah.
And I went in and I told the mom to give her some Gatorade and go home and call me if she's not any better.
Yep. Dr.
And I can tell this story without worrying about HIPAA because it was 30 years ago, and this happened a bunch of times.
Yeah.
So there's no.
It's not an isolated germ.
Health information that's identifiable because it happens so often.
Yeah.
So anyway, the point of that story is if you are a diabetic and you go in and your blood sugar is elevated and you have ketones, they're going to admit you immediately before they even check your blood gas and realize that you're not acidotic.
Okay.
And they will call you DKA. So you got to be careful and you got to be aware of that. So if you do go to the hospital, you say something.
Okay.
Kim Chickens will vouch for me on this one.
She'll hook you up.
All right. But talk to your endocrinologist. Uh-oh. What happened? I don't know. Okay, now we're good. Talk to your endocrinologist and about the hypoglycemia. And get that sensor checked because I don't buy it. Okay?
Yep.
All right.
Dr. Steve and crew, hope you're all doing well.
Doing great, man. Thanks.
Super great. I'm doing well, too.
I'm excellent.
Hey, I'm on a cholesterol atorvastatin 40 milligrams.
Okay, atorvastatin, but
My
we knew
blood
what you
work
meant.
shows everything else is good, liver enzymes, kidney, all that, sugar. I'm 62 years old and really, I would say, good health. The only medication I take. It says to take it by mouth at bedtime.
Yes.
But I read the warning instructions, said not to take it if you've had 3 or more alcoholic drinks.
Yes.
And something about grapefruit.
Yes.
But there's very few nights I don't have less than 3 or more drinks. So why do I have to take it at bedtime?
Okay.
And would it help the impact on my liver if I didn't take it at bedtime but took it during the day? Love the show.
Hey, thanks, man. So the answer is yes, it would, but then that statin wouldn't work. Mm-hmm. The statins are HMG-CoA reductase inhibitors. And HMG-CoA reductase is an enzyme that helps to make cholesterol, kind of, and if you inhibit it, you will lower your blood cholesterol and you will decrease plaques in your heart, and you can actually regress plaques in the heart. That's been demonstrated. Statins will, and Scott's already champing at the bit on this one. But let me give the allopathic side of it, and then you can talk about the bullshit quackery side. I'm sorry, I mean the traditional. I'm just kidding. The Dr. Scott side. Anyway, they have been shown to decrease heart attack and stroke in people who are at risk. You have to treat about 90 people, though, to prevent one heart attack. So the benefit to the individual is low, but it ain't zero, and it's worth it if you're at risk of having a heart attack or stroke to take your statin as prescribed. Now, the problem is that HMG-CoA only does its thing when you're not eating. Mm-hmm. And so the only time of day that Americans aren't eating is when they're sleeping.
Yep.
So you have to take it at bedtime or it won't work. Mm-hmm. That's number one. The other thing about grapefruit juice is, and we'll get to the alcohol part too, is that atorvastatin is metabolized by the hepatic enzyme cytochrome P3A4. Now, simvastatin is a lot more vulnerable to this than atorvastatin is. But if you take another drug that inhibits cytochrome P3A4, it vastly increase the dose of the medication. And when you do that, you're going to increase the risk of having adverse effects like Dr. Scott's getting ready to bitch about in a second. So one of those would be erythromycin is a drug that could do that. Fluvastatin. Fluvastatin is okay. I was thinking of Ketoconazole is one, if I remember correctly. But also, weirdly, grapefruit juice.
Mm-hmm.
So if you're on a statin, don't drink grapefruit juice. You can have all the orange juice you want.
Right.
But go easy on the grapefruit juice because it can do that. Now, the alcohol thing is because this enzyme is a hepatic enzyme. And so you don't want to be straining your liver with two drugs at the same time. So that's why they say that.
Mm-hmm.
Okay, now the 3 drinks, I'm not 100% sure I know where that number comes from, if that's one they pulled out of their ass or if there's actual science that says 2 is okay, but 4 is bad, whatever. All right, so go ahead. I know you're waiting. Dr. Scott
I
hates
was so
statins.
good. I was
no,
so
you were
good.
very good.
I was
you
very
let me,
and
you
I
let me say
appreciate
my
it.
piece. And
I'll let you say your piece. I'll say my piece. I will say there is a time and a place for all of those medications. Absolutely.
Okay. Well.
Yep.
All right. I agree with that. And I also don't think they should just be prescribed for no reason.
And you know, we talked a couple weeks ago about the statins on the show, about how some new research has shown that taking them once a week is equal to, and that may be something for him to consider too.
And my doctor did that.
Yep.
And I still want to take it every day, even though it causes me myopathy. But that's because I'm weird.
Yeah.
I've got to get to where I'm okay taking it once a week.
Well, and you should, because the research says it's okay for you to do it, Dr. Steve. So you can do it, and other research
for primary prevention. Is that what it was?
For primary.
Let me look
prevention.
it up while you're talking.
And remember, the other alternative is donating blood, which has been shown to help lower serum cholesterol. But I would suggest he keeps drinking his 3 beers a day, because it sounds like he's in pretty good shape. Keeps his blood thin, keeps him happy.
What I'm
good for you.
Here's the thing. I can get my blood cholesterol down by donating blood. What I want to know is, does it prevent heart attack and stroke? Now, I know that blood donation has some beneficial effects in that regard. I don't know what the magnitude is. I'd have to look that up. Here, this one says once weekly low-dose rosuvastatin is an effective, rosuvastatin is Crestor, right, is an effective and well-tolerated lipid-lowering therapy option for patients not at LDL goal, which is me, and previously unable to tolerate statins because of a history of myalgias. That's great. They got their LDL down. I want to know, is it still prevent heart attack and stroke, though? That's the part of the study they didn't do. They just showed that you get the same LDL reduction. And we've already demonstrated on this show it's not just about LDL reduction, because you can reduce LDL with another drug called Zetia to the same extent, but you don't get the same magnitude of prevention of heart attack and stroke.
Right.
So it's obviously the HMG-CoA reductase inhibitors are doing more than just reducing LDL. Maybe it's total body inflammation. Who the hell
Well, Dr. Steve, and what you're saying right there is true. And I've agreed with you from the beginning of this. They have shown that a statin drug right after a heart attack or right after a cabbage is very beneficial for the inflammation in the coronary arteries. I'm on board with that.
Interesting.
100% on that. Yeah. So I think, it could be, Dr. Steve. You know, in Chinese medicine, liver does affect inflammation, and so lowering that might help a little bit. That's why I believe in 2 or 3 beers a night, as long as they're 24-ounce beers. If you know who asked me how many beers I've had tonight, I tell her in full confidence, 2.
Yeah,
they were just
right, but they're two
24 ounces.
You're talking about who that calls you when she's in Florida and asks you what you're doing and how many beers did you have tonight?
That's
like
right.
that?
That's right.
Yeah, 2.
We better be nice. She may be listening today.
That's okay. Well, I love her.
No, I don't know. I'm just kidding.
The Big Joe, my mother-in-law, will say, "Oh, I don't know why I don't lose weight. I just eat once a day, she'll say."
Yep.
And it's true. She's true. She's not lying. I've watched her. I've gone on vacation with her. She does just eat once a day, and it starts at 7 in the morning, and it goes until she goes to bed at like midnight. She's just constantly eating, just always shoving something in her face.
Yep.
And then wondering why she doesn't lose weight. One day she came to me and said, "Now, Steve, I'm on a new diet." And I was like, "Wow, what is it?" She said, "I just eat jelly beans all day long."
Oh, my God.
Okay, well, now you're malnourished. Now, you will eventually lose weight, but
yes.
I wouldn't recommend it.
That's great.
All right. Okay, let's do this one. And then next week we've got one from Tucker Carlson about fame corrupting doctors. And that's why I've chosen not to be famous. At least that's what I tell myself. But we'll do that one next week.
Hey, Dr. Steve and Dr. Scott.
Hey.
Whoever else is there. How you guys doing?
Good, man. How are you?
So I'm on testosterone replacement therapy.
Excellent.
And like a lot of guys who are doing it, I also take HCG. I'm sure you'll explain to everybody what that is.
Why?
For. And my clinic just informed me that it's just been banned by the FDA.
Yes.
For no good friggin' reason.
Okay.
So no more HCG unless the pharmacies want to jump through hoops, which apparently costs a lot of money per batch, and it's not worth it. So they're all just dropping it now. And now we have to go on a thing called I can't remember the name of it, but it's supposedly not nearly as good as a replacement for HCG. Can you talk about this and the alternatives and why the hell did the FDA do this? Because there seems to be no good reason according to my doctor. All right. Thank you. Take care.
Okay. Jesus, we need more time than
Yeah,
this.
as a sound kind. Maybe we should save this for next time for sure. That's a pretty deep question.
Okay, so what they're going to put him on Clomid. So HCG is human chorionic gonadotropin, and it is produced in pregnancy. It does stimulate the Leydig cells in the testicles to produce testosterone in people who have hypogonadotropic hypogonadism, and that's people without associated primary testicular disease. So it is not something you should just be giving to every person with low testosterone, and that's why. And then, I thought he was going to ask about HCG and diet, and they were using these HCG diets and putting people on 600 calories a day and then giving them a shot of HCG and then charging them all this stuff. Well, at the time, that vial of HCG cost about $1, so people were making 10,000% profit on this stuff, and it did absolutely nothing. So if he wants to email us back about his testosterone, and if I know a little bit more about it, I could answer that in his specific situation.
Dig a little deeper.
So hypogonadotropic hypogonadism due to congenital defects or people who have permanent acquired, in other words, they got it later, structural defects, should be treated with testosterone replacement therapy unless the patient desires fertility, and then you can do some other things. Long-term testosterone replacement doesn't impair future fertility. You can still get pregnant, but you may have to come off of it. You may require more time for initiation of sperm function. We call that spermatogenesis. Once you take the person off of that and put them on Clomid or clomiphene citrate, which is what we use in men with low testosterone that want to maintain some fertility.
Right.
But if they desire fertility, replacement can be achieved also by using beta HCG. Okay, instead of the clomiphene, and it's a lot cheaper. It stimulates those Leydig cells to produce testosterone in that form of hypogonadotropic hypogonadism, and people that don't have associated primary testicular disease. So, and then you can adjust it to get the effect that you want. Just giving it along with it, I don't see the benefit of that. Are you seeing anything on that?
Mm-mm. No, nothing at all.
Yeah, so I'm confused by this. I'm going to have to do a little bit more research on this one and see what's going on out there. It sounds to me like it's an add-on therapy so that people can maybe charge a little bit more. There may be a legit reason for it, but I'm getting my information right now from Expert Opinions in Pharmacotherapy, which is not some shit journal. And it's called An Update on Male Hypogonadism Therapy by Surampudi and Swerdlov. So also not two slouches in this field. So, all right. Got any? Okay, so you had something from the chat room. What do you got?
Yeah, so we had a question about rabies.
Rabies?
Yeah, pretty tough question.
What? You mean the hydrophobia?
So talk like a hick to you. She's got a.
So I used the right voice.
Yes, you did.
You got that hydrophobia, don't you?
Hydrophobia. You got a child with a science project.
Okay.
And,
okay.
And looking into rabies, and her question was how many people have survived rabies.
Okay. So did you just Google that for her?
Well, I did, and what I found out was that it's
not very many.
It's considered to be like the most deadly.
Yep.
Yeah. Of all those diseases if left untreated.
So what we would want to do is give you odds of surviving rabies.
Yeah, which is almost zero.
Yeah. As of 2016, only 14 people survived rabies infection after showing symptoms.
Mm-hmm.
Rabies caused 59,000 deaths worldwide per year, about 40% of which are in children under the age of 15. Well, that sucks.
Mm-hmm.
So I'm going to put that in the chat room. She can just cut and paste that.
Mm-hmm.
Amy, I don't know how old this kid is. Do they need a citation? If they need a citation, I can get it for you.
Mm-hmm.
Okay, here we go. Here's one. This is an more recent one. Survival in human rabies, but left against medical advice, and death followed. Ugh. Community education is the need of the hour. So what this is human survival after developing rabies is very... What? Okay, this is... Whoever wrote this does not speak English, and this is Journal of Family Medicine Primary Care. I don't know what that journal is, but this is very poorly edited. And being the editor-in-chief of a national medical journal and having a journalism degree, this kind of stuff drives me crazy. Let me read this first sentence for you. So I'm already a little suspect, but it might get you the information that you need anyway. Human survival after developing rabies is very scary to humanity.
What? That's terrible.
All right.
Oh, my goodness.
We report a case of a 50-year-old woman from Uttar Pradesh, northern India, who presented with 5 days. Listen, I'm not making fun of somebody, Hindi-speaking person writing. I'm just making fun of whoever edited this because it's printed in English. Who presented with 5 days of fever and 1 day of altered sensorium associated with agitation, hydrophobia, and bedwetting after 20 days of WHO Category 3 bite in the face by a rabid dog. No.
Oh, yuck.
She had taken 3 doses of anti-rabies vaccinations, but not immunoglobulin of post-exposure prophylaxis. Another bad sentence as well, but we understood what they meant. Laboratory investigation showed a rising titer of virus neutralizing antibodies. That's bad. So what that means, if you're producing antibodies, it means you're producing them to something, and that means that the something is still there in both serum and cerebrospinal fluid. So this person had a bunch of lumbar punctures as well. We treated the patient according to the modified Milwaukee protocol. The patient remained to survive and had a recovery trend during hospital stays of 15 days before relatives took her. Okay, another sentence. Before relatives took her left against medical advice. Not a sentence.
No.
As we know, rabies has approximately 100% mortality rate, but by using aggressive treatment approach like the Milwaukee protocol, a patient may survive. Rabies can be effectively prevented by using adequate post-exposure vaccine prophylaxis and rabies immunoglobulin. So what that is it's basically convalescent serum. You're taking serum that has, we all understand this now in the age of COVID, monoclonal antibody therapy. That's basically the early monoclonal antibody therapy. After bite of a rabid animal, our report, along with other published reports, should give more motivation to clinicians and education of the public to have an intensive treatment approach and patients, respectively, to make rabies survival. Okay, don't know what they were saying there, but so what happened was this person was treated aggressively, and then apparently they left, but they didn't tell the rest of the story. It's in the title, but they don't tell it in the article that after the family took the patient home, they died.
Ugh.
So rabies is nothing to be dicked around with. If you think you were bitten by a rabid animal and you can't isolate the animal so that they can test it, because if they test it and it doesn't have it, you don't have to do anything.
Right.
Then you need to present to your primary care and say, listen, I think I was bit by a rabid animal. Let them get you going on vaccine prophylaxis.
Yeah, before you start becoming symptomatic.
If you get to the point where you have hydrophobia, as Myrtle would say, it's really late in the game.
Yeah, it's going to be a challenge.
Good. Rabies, I get where they're coming from. I have some friends from India. And there's still, I don't know how many cases of rabies they have in that country and some in the country, countryside in India. But I know she's probably 20 years younger than I am. She's terrified of dogs because to her, dogs are monsters that carry rabies.
Wow.
So, and I understand that. And I had one of my teachers was a missionary in India, and this is back in the 50s. This is when nobody had vaccines. And one of his friends was carrying a dog in a burlap sack because they picked it up. It was threatening some people, and it bit him through the burlap. And that person didn't pay attention to it and ended up getting rabies and dying.
Oh, shoot.
And then I remember when I was a kid, before we had rabies vaccines for dogs or for people, them showing these public service announcements on TV that scared the shit out of me. I've talked about it on this show before. Black and white, this guy coming down the stairs and the screen starts flashing. He starts foaming at the mouth. It was like watching a zombie movie. I'm 4 years old. Scared the shit out of me. Gave me nightmares.
Oh, yeah.
And I have that image burned into my brain.
Yeah. It's hard to get rid of.
Rabies is scary. Don't dick around with it. Don't try to capture a bat with your hands.
No.
If it's in your house, there are ways that you can get it out of there. But if you agitate that thing, the saliva, if it starts slinging saliva around, you can get it from that too. So it's better to get an expert. Just get the damn thing out of your house.
Get you a big fishing net.
Yeah, well, I've done that.
Or a baseball glove.
I'm not 100% sure that, let me see, how to get a bat out of your house. Because I think that there are some ways that are more dangerous than others.
Oh, yes. A shotgun, bad idea.
Yeah, no, that's bad. Here's from EerieInsurance.com, so they ought to know. Quickly place a plastic container or cardboard box over the bat, then slide cardboard. I would do that with a tarantula. Or not thick paper, cardboard under the box, and then release the bat outside. Get it near a tree so it can climb. They can't take flight from the ground. I didn't know that. Did you know that?
I did
They
not
have
know
to
that.
jump. Well, they're
Or
mammals.
Fall. They have to fall.
Yeah.
Like they sell it.
They're mammals, so they can't just take off from the ground.
I did not know that.
Yeah, that's interesting. It's just their wings are just basically armpit membranes.
Yeah.
Isn't that something?
Loose skin flapping around.
All right. Popular Science says how to escort a bat out of your home. I'm just trying to see if there's some ways are more dangerous than others. Okay, first, don't panic. Close off the room. Clear a path to the outside. Open available windows or doors that lead outside. Pull away any curtains, screens, or furniture. Don't turn off your indoor lights. You won't be able to see the bat. Yeah, it's fine. Don't shut out the lights because you think that they're blind and they can't see if the lights are on. That's not how it works. Keeping tabs on its whereabouts is key. If it won't fly outside on its own, it's time to take matters into your own hands. If the bat won't leave on its own, you'll have to capture it and release it. Have someone keep an eye on the bat's location as you gather the necessary supplies. A long sleeve shirt, long pants, gardening gloves, a broom, a plastic bin, and a piece of cardboard. So they're saying the same thing. All right. Okay. Just don't get bit. And if you do get bit, you don't dick around and go get the vaccine. All right? Anything else?
No, that's all of them.
Okay. I think we will have NP Mel B is going to be a few weeks from now. I think we'll have PA Lydia next week, I think.
Okay.
And then DNP Carissa the week after, and then Mel B will be back. So very good and very excited about that. We always enjoy when they're here, and they add a little different energy, and it's always fun. We've got good reviews on them. So.
Yeah.
All right.
Cool.
Well, listen, let's get out of here. I guess I need to read the outro, don't I? You got anything else, Dr. Scott?
No, I was just checking everything else.
Have we plugged any of your stuff?
No.
Well, we will.
Yeah.
We'll go back in time, and we'll do it at the beginning of the show.
Cool.
How's that?
Sounds good.
For people who you can figure out what just happened. Let's see here. All right. Well, listen. Thanks always go to Dr. Scott, Kim Chickens, and Sean Pedrick. Thank you for joining us in the chat room today. Anybody, any of our other regulars? Amy, I talk funny to you. I talk like a hick to you. Who else is out there? Cardiff Electric. Uh-oh. Wait a minute. He's got a question out there. Wait, and the Creep Off channel? How is that? How are they in here? Says, I love the TV show tonight on TLC. The promise is doctors remove things stuck in bodies, mostly ears and asses. My question is there a lavage for your ears? I'm obsessed with cleaning my ears. Actually, yes, there is. And I don't remember the name of it, and it's not motorized. It's a hand pump.
Okay.
And just Google ear lavage, and you will find it. Let me see if I can find it. Excellent question. You can't ignore our boss,
I didn't see
Dr.
it.
Scott.
No, I didn't see it. I swear I didn't.
Ear lavage kit. I mean, you know he owns our network, right? Okay, Here it is. It's $18. Earwax removal tool by Tilcare. I'll even give the name. Ear irrigation flushing system for adults and kids. And it's got a little bucket that you can collect all the stuff in. It's got some little tips. And then you put the cleaning solution in what looks like a Windex bottle. And then you stick the tip in your ear and just pull the lever. Just don't be too over vigorous. And I got to be honest with you, Mr. Cardiff. Don't clean your ears too often. The wax is there for a reason. And if you clean them too often, what you'll get is dry, flaky skin inside your ear, and that's worse than having earwax in there. The earwax kind of keeps the tissue nice and soft and moist.
Fluid.
And fluidic. Yeah, okay. Any other questions? What's the worst disease you can catch from not cleaning under your fingernails? Asking for a friend. Okay. Listen, you can collect, and I know exactly what they're asking, and I'm just go to Dabblers Anonymous if you're curious on Reddit. But you can collect some disgusting things under your fingernails, and then if you're inhygienic, I'm sure the friend that you're talking about has very good hygiene otherwise. But if you're inhygienic and you stick your thumb in your mouth and you suck on it, or if you pick up your food and then stuff from under your nails gets in there, I mean, we're talking fecal coliforms. In other words, E. coli can be under there. You can have saprophytic organisms. Those are organisms that live off of dead things. Like those are things that break down logs in the woods, that kind of stuff. Those are saprophytic organisms. You get an infection with one of those, and you, my friend, will have quite the infection. So clean under your fingernails, cut them. If you can't do it, go get a pedicure. If you can't afford it, which some people who drink a lot of, if they're drinking a lot of Coors Light and not eating and using up all their money on beer, they can't afford a pedicure, then go buy a brush. And it costs you $1 at CVS. You can get a nail brush and just brush under your nails. But you got to keep them clean, because the stuff under there, you could culture out some of the most disgusting stuff, even with relatively clean nails. But if you've got filth under there, it's not good. Let's see, what else? I hope the Creep Off channel's still listening. Are you guys still there? Colin Karn says a fellow named Aqua Chigger that does metal detecting on YouTube got bit by an aggressive rabid beaver. Oh my God, yeah. If you see a beaver coming at you, it's rabid. Same thing with a fox, a skunk too. If they're aggressive, their natural instinct is to run away from you. His wife is a veterinarian and does animal rescue, so he already had a rabies vaccine. Okay, cool. All right. Mr. Cardiff, will you let the Creep Off channel, whoever was running that, know that we answered their question at the end of the show? All right. Thank you, sir. Thank you, sir, and thank you for running our network. Thanks always go to Dr. Scott. Can't forget Rob Sprats, Bob Kelly, Greg Hughes, Anthony Cumia, Jim Norton, Travis Teff, That Gould Girl, Lewis Johnson, Paul Ovcharski, Chowdy 1008, Eric Nagel, the Port Charlotte Whore, the Saratoga Skank, the Florida Floozy, Roland Campos, sister of Chris, Sam Roberts, She Who Owns Pigs and Snake, Pat Duffy, Dennis Falcone, Matt Kleinschmidt, Dale Dudley, Holly from the Gulf, Christopher Watkins Double, a.k.a. Steve Tucci, the great Rob Bartlett, Vicks, Nether Fluids, Cardiff Electric, producer Chris, Casey's Wet T-Shirt, Jen from the Jingles Department, Carl's Deviated Septum, the inimitable Vincent Paulino, everybody, Eric, Zane, Bernie, and Sid, Martha from Arkansas's Daughter, Ron Bennington, and of course our dear departed friends, GVAC and Fez Watley, Barry the Blade, whose support of this show has never gone unappreciated. We miss them forever. Listen to our SiriusXM show on the Faction Talk channel, SiriusXM channel 103, Saturdays at 7 p.m. Eastern, Sunday at 6 p.m. Eastern on demand, and other times at Jim McClure's pleasure. Many thanks to our listeners whose voicemail and topic ideas make this job very easy. Go to our website at drsteve.com for schedules, podcasts, and other crap. Until next time, check your stupid nuts for lumps, quit smoking, get off your asses, get some exercise. We'll see you in 1 week for the next edition of Weird Medicine.